Hi, I'm Isabel Ballard, and I'm here to present research conducted exploring the impact of equine facilitated therapy on female veterans' mindfulness. The study was conducted in 2019 with 29 female veterans participating. The research took place at Fieldstone Farm Therapeutic Riding Center in Chagrin Falls, Ohio, in conjunction with the Louis Stokes Cleveland VA Medical Center Department for Women Veterans in Cleveland, Ohio. Equine facilitated therapy is an intervention directed by a licensed mental health professional and a trained equine specialist. In collaboration with the horse, the team assists the client reach specific goals and outcomes. The animal as collaborator is seen as imperative in the work. The horse, as a large prey animal, exemplifies the dichotomy between great power, grace, and inherent vulnerability, which may serve as an effective tool in therapeutic work. Horses undoubtedly bring a unique energy to a traditional therapeutic interaction between client and practitioner. There is empirical evidence supporting that horses may have direct positive biopsychosocial effect on veterans experiencing PTSD. Practitioners of EFT suggest that the horse can facilitate the development of responsibility, unconditional love, self-efficacy, required helpfulness, self-esteem, confidence, empathy, resilience, and emotional intelligence. As we begin to better understand the impact exposure to war stress has on both the physical and mental body, the significance of successful treatment becomes paramount. The research conducted was a mixed method study using a pre- and post-test design to explore perceptions of mindfulness by female veterans who participated in a structured EFT curriculum. The study uses a clearly defined curriculum delivered by credentialed professionals at a premier Professional Association of Horsemanship International, otherwise known as PATH, facility. Equine facilitated therapy is recognized and standardized under PATH International. The curriculum followed included getting to know the barn and the rules, a helmet fitting that was thoughtfully navigated as helmets can be a trigger, and activities with the horses including grooming, leading the horses on a nature walk, and some more targeted activities like Breathe With and an obstacle course. Breathe With was a participant favorite and requires more intimate interaction with the horse. It is an activity that should not be rushed. In fact, this is an opportunity to teach the skill of patience and comfort and quiet. The idea is to relax with the horse. As one hand reaches up over the horse's back, the other hand reaches under the belly. The person's chest is then level with the horse's heart girth behind the shoulder. The idea is to relax to the point of matching the breaths in and out to the horse. At the same time, the tactile sensation of the horse's large, warm body is often a calming experience. However, if a person is not relaxed, the horse will often move away from the pressure of their hands and body. Even when a person says they are calm, the horse can feel if they are harboring anxieties. Rather than correcting the person, the facilitator can simply reframe to the horse. It seems that Romeo isn't ready to stand still. What can you do to help him to relax or settle? After a few breaths, stretches, cooing words, or reflection, the person works with the horse to actually regulate their self, thereby allowing the horse to settle, and together they breathe. The whole process may take 5 minutes or it can take 30 minutes. Either way, the experience is meaningful and mindful. Each participant was given the Toronto Mindfulness Scale to complete for a baseline marker. The Toronto Mindfulness Scale is a 13-item scale designed to measure curiosity and decentering, two core constructs of mindfulness. The veterans completed the scale once again before departure. Veterans who participated in the program demonstrated a statistically significant increase in self-identified mindfulness. The data was supported by the qualitative data, including feedback from the veterans. Based on the results, 4 recommendations for this program and programs of this nature include 1. Establish the environment, 2. Focus on mindfulness, 3. Allow time to breathe, and 4. Use consistent horses. While the popular appeal of EFT is evident, interest is expanding faster than the research base, risking the proliferation of costly and potentially ineffective or dangerous interventions. Limitations of this study are predominantly related to the simplicity of the measures used. Had the data been participant-specific, researchers could have included analysis of change over time by personal experience. It is our hope that this data can be viewed as a foundation for future studies that explore these variables in more depth. Overall, the current study demonstrates that veterans' interactions with equines impacts their mindfulness throughout their experiences at the farm. The veterans established a significant increase in their mindfulness scores post-equine intervention. The study shows equine intervention facilitates the increase in mindfulness in veterans. Thank you so much.